Thank you very much. We have a numbers of days to report on today. So the following 4 reporting periods. From Friday to Saturday, we had 123 new cases of COVID-19. From Saturday to Sunday, 116 additional cases. From Sunday to Monday, 107 people tested positive for COVID-19. And from Monday to today, 83 additional cases. That brings our total of new cases since Friday to 429, including 12 epidemiologically linked cases, and bringing our total in British Columbia to 6,591 people who have been diagnosed with COVID-19. That includes 2,249 in the Vancouver Coastal Health Region, 3,428 people in the Fraser Health Region, 184 people on the Vancouver Island Health Region, 460 people in the Interior Health Region, 186 people in the Northern Health Region, and 84 people who normally reside outside of Canada. We now have 1,386 active cases in all health authorities in the province. Of those, 32 people are in hospital currently, 12 of whom are in critical care or ICU. Over the weekend, we've had an additional 2 people who have died from COVID-19, both of them residents of long-term care, one in Fraser Health and one in Vancouver Coastal. And our condolences go to their families and to their communities and to their care providers. We know that we all feel their loss. There are now 3,063 people under active public health monitoring because of exposures to people with COVID-19. And 4,978 people who have recovered. We have 3 new healthcare associated outbreaks over the weekend. One of them at the Burnaby General Hospital, 3C, in Fraser Health, and also at the Rideau Retirement Centre in Fraser Health. And an additional second outbreak, luckily a small one at this point, at the Holy Family Hospital in Vancouver Coastal. As you are aware, the large outbreak at that facility had been declared over just over a week and a half ago. There is now a single case, and we are hopeful that with all of the precautions that are in place, that will remain a single case. That leaves us with 14 active outbreaks in our healthcare system, 11 in long-term care and assisted living, and 3 in acute care. And our total of people affected in our in healthcare is 753, 458 residents, and 295 staff. We have no new community outbreaks to declare. However, I think people are well aware that there have been a number of exposure events over the weekend in many places around British Columbia, but particularly in the Lower Mainland. And we encourage people to continue to check websites regularly for alerts and to follow the guidance of public health. So as we get back here in after the Labor Day long weekend, as we get back to work for many people and back to school for many people, it is the time for all of us to cut back on our social interactions. This is what we all need to do now to reduce our risk of contracting COVID-19 for ourselves and for everyone around us. Keeping our household contacts and our controlled work and school groups safe means having fewer contacts with other people, particularly people we don't know. Whether it's a private party in somebody's home, going to a nightclub, going to a bar, the potential to transmit the virus is the same. When we're in those closed spaces, when we're having close face-to-face contact with people, and when we're in crowds. Being indoors is riskier than being outdoors. We know that now. Being in close face-to-face contact with people that we don't know, that are mixing with other people, we know that's a risk. Being around people outside of our close household bubbles for an extended period of time is now a risk too. And in many cases, what we are seeing is large numbers of people being exposed inadvertently in those environments, particularly in some of the nightclubs and the bars and the parties that we've seen, in many cases fueled by our use of alcohol. In recent weeks, public health teams have been heavily focused on responding to these community clusters, to identifying people, to making sure that the mostly young people that we're seeing in these exposure events are detected, are found, are isolated so that we can stop those chains of transmission. But this has been a very challenging thing to do. There have been a major source of transmission in many of these locations since our Phase 3 reopening. And despite weeks of effort by public health teams, these venues are still the source of significant risk to everybody in British Columbia. And as you know, we adjusted the orders to try and make it a safer environment for people, but it in turn makes it more challenging to protect those who are more vulnerable to serious illness. And we are starting to see some spillover into other parts of our community, and we know particularly our seniors and elders are most at risk. A lot of time in public health resources have been spent on contact tracing connected to these venues, because people, whether it's a private party, whether it's at a banquet hall, whether it's in a nightclub, are typically not connected to each other. And it is extremely time-consuming to find people. As a result, we need to ensure that our public health teams are able to take care of everyone in British Columbia, to continue to find that balance of those cases and making sure that we can track people, we can find their contacts quickly, and we can support people effectively to stop the chain of transmission. As a result, I am amending my order on bars, nightclubs, and banquet halls. Effective today, all nightclubs and all standalone banquet halls are ordered closed until further notice. In addition, liquor sales in all bars, pubs, and restaurants must cease at 10 p.m., and these venues must close at 11 p.m. unless they're providing full meal service, in which case the meal service can continue but not serve alcohol. In addition, we are putting in provisions to make it easier for people to avoid having to speak loudly or shout or have close contact. And that means music or other background sounds, such as from televisions in bars, lounges, pubs, and restaurants, must be no louder than the volume of normal conversation. As we know, issuing orders is not something that we do lightly. It is our last resort, and we have spent quite a lot of time working with industry, within the banquet halls, in the nightclubs, to try and put in measures that will protect people from this virus, and will protect our communities from people spreading it and inadvertently bringing it home or bringing it to their workplace, bringing it to other parts of our community. And we have managed to do that through the summer. But as our cases are climbing, as we are starting to move into the important parts of our community that we need to support moving into respiratory season in the fall, we need to make some changes to reduce the risks of these environments. We know the risk is greatest in nightclubs and bars, and we know that most restaurants in particular have been doing a very good job at keeping things under control. We know we had some challenges where people wanted to come in with large groups. We know that those have been dealt with for the most part, and people are doing the right thing. So these restrictions are meant to take away that late night temptation that people have, where we know that there's been mixing going on and where transmission is happening in these venues across the province. We recognize that these venues have tried, and we've made adjustments, and there are still exposures happening. And both staff and customers are being put at risk. So that is the reason we are putting in these additional restrictions today. We need to find our balance to get us through the next few months to a year that we're going to be living with COVID-19. And that means we have to have both our economy, our education system, and our health system working. And we need to get back to that balance that we found when we were able to stop this virus earlier on this year. Now is the time for all of us to go back to our smaller, safer social interactions, especially if we are increasing our social interactions in other ways, like going back to work and going back to school. The importance of having our work and school and preserving health can't be underestimated. We need to, each of us, imagine our social interactions on a scale, and to stay safe, we need to be in balance. So if we are increasing our interactions in one way, we need to decrease them in another. If you have children who are going to school, who will be joining their learning groups and their classes where they'll be having contact, you need to consider spending less time with others in ways that you may have this summer, with social interactions, with parties, with friends, and with after-curricular activities, depending on your own situation. In particular, house parties and social visits now we need to keep low. We need to go back to where we were when we had our bubbles of 5 or 6, and we still maintained our distance, particularly if we had people over who weren't within our household. So keeping your safest distance, which is around 2 meters, ensuring hand hygiene, ensuring that we are staying away from others if we're sick, are the things that we need to go back to get us through this next few months. Let's also recommit to keeping our walls strong here, to keeping our firewall up, protecting ourselves and those around us, and focusing on community wellness and our protection of those who are most vulnerable. This will help us to break those chains of transmission and bring our curve back down where we want it to be. Let's also remember that we can do this. We can get through this together. It is not forever, but it is a balance we need to find for now. And we need to remember to be kind and to be calm and to be safe.